of the Mixtape with Scott. I'm Scott Cunningham, the host, professor of economics at Baylor University. This is a podcast that's about listening to the personal stories of living economists and trying to, over time, create an oral history of the economics profession over the last 50 years. Today's guest is a health economist, associate professor of business economics and public policy at the University of Michigan's Ross School of Business, Sarah Miller. Sarah Miller did her doctorate in economics from the University of Illinois in 2012 and just hit the ground running. There's people like that. Some people, like me, graduate and are very slow to figure out the job. And Sarah is on the other end of the distribution. She was writing papers in graduate school, published, getting R&Rs even before she graduated. It's not, the word's not, I don't even think the word is ambitious. It's a latent factor. You know, she's got such a, she's got that bundle of attributes that just makes someone be able to write highly impactful papers. And part of what it is I think you're going to see is the love in her heart for the work. It's the curiosity and the creativity and just seeing that is a way that she can express herself. She's published in the American Economic Review, the Quarterly Journal of Economics, New England Journal of Medicine, just a lot of really big, impactful papers. We're going to talk in detail about one of her papers on the effect of Medicaid on mortality, which is one of my favorite papers. I teach it. For those of you that have been in my workshops, you know that I basically present that paper as though it's like a blueprint for social scientific evidence. It's just absolutely brilliant. And I think also just makes a real contribution to our understanding of the world in which we live in the United States, and the impact that health coverage can have on people's lives, even extending how long they live. So it's really wonderful, the kinds of work that she does. Thank you so much for supporting the podcast. Thank you so much for the emails. Thank you so much for subscribing to the Substack. Thank you so much for everything. Hope you enjoy this interview with Sarah as much as I did. See you in a minute. Well, it's my pleasure to have on the show someone that I've spoken to online a billion times, and read papers of hers about a trillion times, but have not had a chance to actually talk. Sarah, thank you so much for being on the show.
My pleasure. Thank you for having me.
Before we get started, for the sake of the listener, could you tell us your full name, your full title, and who pays your paycheck?
My name is Sarah Miller. I'm associate professor at the Ross School of Business in the Business Economics and Public Policy group, and that's at the University of Michigan. So that's the name on my paycheck.
That's the name of your paycheck. Awesome. Well, before we get started, let's start with an icebreaker. What's a vacation that you took that every now and then you notice in your mind that you'll just think about it? And you've thought about it maybe a couple of times. So it doesn't have to be your favorite, or it doesn't have to be your worst. It's the only thing is you just have noticed that every now and then you've thought about it.
That's a great question. Yeah, I would say, well, this is maybe not really a vacation, but we treated it as a vacation. But the last AEAs before COVID were in San Diego, and I went with my son, whose birthday is January 2nd. He was turning 3, and we went to the conference very briefly, but then we went to Legoland. We went to do all this like fun San Diego stuff, and went to the beach, and we just had a great time. And I guess I remember it, or I think about it, because it was really like the last vacation before we came back, and then everything was like totally shut down. So I found myself during COVID thinking about it a lot, like, man, I missed that place we were at in January in San Diego.
Right. Yeah. That's awesome. Have you ever, so have you ever gotten to do that again ever since have you gotten to go now that COVID's kind of lifted
I haven't, but I'm planning to do that next year. So
next
we're
year?
going to be on sabbatical next year. We're going to be in California, so I'm looking forward to going to Legoland now, and especially because my son's a little bit older, so I think he's going to even have more fun. So I'm
That's
excited.
awesome. That's awesome. Well, tell me about yourself. Where did you grow up?
So I grew up in Illinois. I grew up in kind of the center area of the state. So I went to school in Peoria. That's where I was when I was younger. My parents later moved to so Peoria is like a smallish, medium-sized city. And later my parents moved to kind of a more rural area in Illinois, which is where they live now, a little bit north of there. So
Hmm.
um, I say
Is
Illinois,
Peoria
usually
where
people
they
think,
do?
oh,
Is Peoria
sorry.
where they do the Roger Ebert film festival?
Yeah, they do the film festival there. We have a couple notable Peoria alums. Richard Pryor was from Peoria. Betty
Oh,
Friedan, who wrote The Feminine Mystique, was from Peoria. So
oh, cool.
random people.
How big is it? How big is it?
That's a good question. I don't, when you're in high school, you don't look up the population, but look it up. About a little bit more than 100,000 now. I think it was a little bit
Mm,
bigger when I was younger because the
mm.
Caterpillar World Headquarters was there.
Oh,
They did a
okay.
lot of employment. They had a lot of employment
Okay.
there.
Did you ever go to any of those Roger Ebert festivals?
No, I didn't.
He was my hero while he was alive. I loved his writing. So what'd your parents do for a living?
So my mom worked for a dialysis company. So she's a nutritionist. She's like a dietitian. And so
Mm,
she would work, making nutrition plans for patients.
mm.
My dad worked in sales in the steel industry. He
Oh,
had worked at a machine shop when he was younger, and when he got older, he was more like on the business side. So he's still in that industry doing kind of connecting suppliers and machinists to
mm.
manufacturers.
Wait, so your mom was working in dialysis, but what was it again?
She's a
She was also in
dietitian,
sales. Oh, she was that.
so she's doing like what kind of food you have to eat if you have end-stage renal disease. There's very like
Oh, got
specific
it.
requirements. So.
Huh. So you grew up with some conversations at the dinner table or something, just like sort of with health care in the air a little bit. Am I like reading into it?
I would say a little bit. Yeah, my mom would definitely talk about things that were annoying her in her job.
Mm,
Things like having to meet certain benchmarks that were set by the insurance plans or by the ADA. So, um, yeah, I mean, I think a little bit, but I wouldn't say too much. My parents did
okay.
always talk about politics, and we did talk a lot about policy in general, but um,
Oh, they were interested in public policy?
they were my dad and I always talked a little. My parents are both pretty conservative, I'd say, and so we would always, and I'm a little bit more on the Democrat side, so we would always have a little bit of, especially when I was in high school, and high schoolers kind of have a little bit of an attitude to them. So we'd always have some friendly debates.
Yeah, yeah. What would y'all talk about at the dinner, like a random dinner table?
Yeah, I mean, I'd say if we were not talking about just stuff going on in our life, if we were talking about policy stuff, we would talk about economics. We would talk about whatever was the policy being debated at the time. I mean,
Hmm.
I was in high school during 9/11, and so there was the Iraq War, and so there were different
Mm,
opinions about that.
right,
Certainly
right.
the other policies under Bush. I remember the Bush tax cuts, for example, and just discussing that kind of stuff.
Oh, oh, that's interesting. Yeah, Andrew Baker, this is random, but Andrew Baker had said a lot of people in his cohort, 9/11 really made them a lot more astute, a lot more uh thinking about public policy, even as much probably earlier than me. And you felt like that too, you and your friends?
Yeah, I mean, I think that's fair. 9/11 was definitely, a moment where things kind of got put on hold for a moment. Like, I mean, I do remember there was this sort of several month period, at least where I lived, after 9/11, where people were just so freaked out by the event that there was
Hmm.
almost no, dissent with what the Bush administration was doing. But then once that kind of lifted, I feel like people, especially a little bit later when the Iraq War started, I think people
Right.
became a little bit more heightened political awareness. Maybe
Yeah.
like what's going on right now on campuses with the Gaza conflict.
Right. 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 So if I could have found you on a Saturday when you were young, maybe like in the seventh or eighth grade, what would I have found you doing? Maybe in the summer or whenever. What would I have been finding you doing?
I think I had a pretty normal schedule. We lived close to the neighborhood pool, so my sister and I would walk to the pool, if the weather was good, most Saturdays when we were that age. We hung out there a ton.
Hmm.
Um, Other than that, I remember playing a lot of computer games online,
Oh yeah.
watching daytime TV. Most of the summer vacation stuff that junior high students did back in the 90s.
Is just you and your sister? Do you have another sibling?
Yeah, just me and my sister.
Okay. Are you older than her?
Yes.
Oh, okay.
Yeah, I'm 2 years older than her. So
Oh, okay. Well, so how large was the high school in Peoria? You went to high school in Peoria?
yeah, I went to a Catholic high school. I think it was about 800 students maybe, so it wasn't that big.
Hmm. Hmm. Well, if I could have eavesdropped on the teachers in the faculty lounge then in high school, and then I heard like them talking about Sarah Miller, what are you saying about you?
Um, yeah, I don't know. Probably complaining I didn't always turn my homework in on time. I
Uh-huh.
I don't know. I wasn't a very I wasn't super studious as a high school student. So
How come? What did you like doing in high school?
yeah, I was in the drama club. I remember I did some of the high school plays. That was a lot of fun. I did track and field, and I did cross country.
Hmm.
So those were the sports that I did. Um, yeah, I don't know. Just
What classes did you like?
I liked history a lot. I took some extra American history classes. I really liked that.
Hmm.
Um, yeah, I'd say I liked English literature. That
Yeah.
was a good one. I wasn't a big fan of the science classes. I thought they were kind of boring.
Mm-hmm. Mm-hmm. So towards the end of high school, like, what did you want to be when you grew up? Do you remember thinking like maybe 12th grade, what it is that you wanted to be?
Yeah, I think I wanted to be a lawyer. I'm not sure I remember. It was a long time ago, but I do remember thinking like, oh, I like yeah, like arguing with my dad about stuff, and I like English and history. That seems like something where you would do a lot of writing, or maybe
Hmm.
law. I can't say that I had a very strong plan.
Yeah, yeah, yeah. Okay. So you end up going to Tulane. I lived in New Orleans from 99 to '02 after I graduated from college. So I really have a lot of special memories there. What was it that took you to Tulane?
I had grown up in Peoria. I had gone to kind of a smaller, a little bit more conservative school. It was a little bit, it was a nice place to grow up. I had a wonderful childhood, but it wasn't that exciting. I wanted something that would be like really different and really fun and new. And I thought New Orleans would be like a something that would be really fit the bill on that dimension.
Yeah.
So that was a big part of my decision. I was just like, man, I want to get out of Peoria. I want to like experience some new things, go out in the world on
Mhm.
my own and kind of see what's going on, have some experiences. I think that was like my major driver
Mhm.
there. But I loved being at Tulane. It was just a wonderful experience for me. I made a lot of friends. Like the food was great, the weather was great. I just had such a blast in college. So I think it was a good decision. I think my mom was a
Mhm.
little sad that I went farther from home than she had hoped, but it ended up being really great.
Oh, so you went to Tulane, you didn't know anybody. You weren't
No,
like, yeah, huh,
yeah.
huh. So is that Would you say that you kind of have that kind of independent streak,
Yeah, I guess you could say
bravery,
that. I mean,
a little bravery?
these things kind of change over your life course a little. And when I was, 18, I really wanted to be away from my family, doing my own thing, being independent. Now that I'm older, I have a kid, and now I like being a little bit closer to my parents. I see how nice it is to have that family support around you. So,
Mm-hmm.
yeah, at the
Mm-hmm.
time for sure, I think I had a real independent streak, and I really like kind of
Mm-hmm.
trying new things, not very
Mm-hmm.
risk averse, and yeah, I sort of come around and realized, actually how great it is to have more family around you.
Yeah, sure, sure. That's cool though. Not every, I mean, obviously not everybody's like that. I mean, you go to a public high school and you say, all my buddies are going to, University of Illinois, and so that's what I'm gonna do. But you were like, I'm gonna go be alone and like invent my life. That's cool. Well, so how in the world end up majoring in economics? A lot of people, it seems like that I talk to, it's like it's either a class, a professor, or a book that kind of like captures their attention. What happened to you?
Yeah, so I started out, I thought I was going to major in political science because I was thinking, oh, I don't know, maybe law school seems like a good major. And I was always interested in history and politics. But then, with a political science degree, you have to take some economics. And I just ended up
Mm,
really, really enjoying it. I remember I
mm,
took like Econ 101 from John Pritchett, who I think is still at
yeah.
Tulane, and just being like, wow, this is like a really cool way to think about the world and to think about people's choices and markets. And
Mm,
it was really, yeah, it was really, really captivating to me. And so then I started taking
mm,
more economics, and eventually I just stopped taking the political science and
mm,
switched over. I think it's interesting how people react to like their first economics class because then now I teach, I'll teach like the core micro, which is like kind of like a Econ 101 type of class here, and you just have some students that are just become enamored, and other students that just don't connect to the
yeah,
material at all.
right,
So
right. But John really impacted you. And he's teaching economic history or something, right? Did you ever, and you were already loving history. Did you ever take any of his econ history classes?
no, I think I took public economics from
Uh,
him and Econ 101. So those were the two I took from him, but they were both really, really fun classes. So
Well, so does the topic of healthcare, is it showing up in your brain at all in this time at Tulane as you're moving into economics?
it is, I think I am starting to think about it more. I mean, it's, at that time, I don't want to say there wasn't a lot of health policy because there was, discussion about Medicare Part D going on. But it did seem like this kind of big hole in US public policy where if you compare it to other countries, we were doing something really different. It didn't seem to be like working out very well for us.
Hmm.
Um, Also I'm just interested in social problems in the US in general and what are they? I mean,
Hmm.
one of them I think arguably is sort of, really entrenched intergenerational poverty. And you think about, well, what are the things that we're doing wrong in the US that other places aren't doing? It seems, well, maybe healthcare and health is interacting with it here. But I can't say it was at the very top of my mind at this
Mm.
point, at least.
But was poverty? You said you took public, so you're thinking about policy and things like that. But then
Yeah.
you brought up poverty too.
Yeah. I mean, I've always been very interested in public policy. I think that's why I was interested in political science and
Right.
law and just in general,
Totally.
government, yeah, the role of government and what can government do to make,
Mhm.
society better. What can government not do? Where is it going to not work well? And so
Mhm.
yeah, I think, then it sort of naturally leads you to think about, well, what are the social problems that we haven't really solved, or what are things that look like
Mhm.
we're not doing that well here in the US? And
Mhm.
I think healthcare kind of pops up there, but certainly other issues do as well, like poverty, segregation, intergenerational mobility, arguably. So
Well, so when you were thinking about law, you were like, my mind would be, are you thinking I'm that like puts me in? public policy, like puts me, in politics, or I might have to move to DC. Or when you were thinking about that, it's not necessarily research, but it's like being more involved directly in the design of policy. But was that ever in your mind that you were thinking you might go that route, or were you always thinking I'm kind of a researcher?
I mean, I definitely don't think I was thinking that I was a researcher. I mean, I think I was thinking that it seems like the legal system in the US is very powerful, and
Hmm.
understanding it and being able to advocate for this or that with, from that training or from that point of view might be a very powerful way to go if you wanted to, do something with your life that was interesting and meaningful.
Yeah. But you were thinking about change. When you're interested in public policy, it wasn't like, oh, I'm just kind of curious about this. It's like there is a part of you that's like, I would like to also change this. Is that right?
Yeah, I think to some extent. I mean, I never really thought like, oh, I want to run for public office or something. That's never been something that seemed appealing to me. But the idea that, oh, I suppose, of course, this is like a very naive 19-year-old's view of being a lawyer, I think. But, oh, if I was a lawyer, maybe I could advocate for people that didn't have anyone to advocate for them, or I could, otherwise have some work that was like meaningful and could do good in the world, and but also coming from, a place of relative power, because to have like the training to be able to actually accomplish hopefully what you would want to do in that like individual level advocacy, but not necessarily like lobbying governments or being a politician or working for a politician.
Yeah, sure. So you get to the end of college, and what are you wanting to be when you grow up at the end of college? Are you wanting to be an economist, or are you just like an econ? I mean, what's the horizon looking like?
Well, in college, I really was really the point where, so I was never very studious in high school, and I wasn't super interested in what was being taught, to be honest, in high school for the most part. And so I just was sort of like, this is kind of lame. But in college, I really loved the classes, and I really um, enjoyed like spending the time to learn the material and think about it, and I also really did well like academically. So it was sort of the first time where I really felt like, I don't know, maybe there's something to this econ thing that I'm maybe especially
Mm,
good at or have a comparative advantage in. And so
mm,
there was sort of a sort of a thought of like, well, I've really enjoyed this as an undergraduate. Maybe I should keep doing it and sort of see where it goes. And I think that's kind of where
mm.
my interest in graduate school
Had
came
you known
from.
anybody that had gone to graduate school, like in your family, or did this feel kind of like a big deal?
No, yeah, no, I hadn't known anyone who had done it. I can't say, I don't think, except the professors that I had at like at school, I don't think I knew anyone who was going in that direction. But no, I had I think a very naive idea about what graduate school was all about. I sort of thought, um, it was sort of like just undergrad, but it just got harder or something, or more
Right. Yeah.
challenging or
Right.
interesting, right? And there was
Right.
some research aspect, but I think it wasn't really until I got there that I actually kind of figured out what we were doing with this
Right.
little enterprise. So
Right. 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 How did you pick Illinois? Are you thinking I want to be now, I want to be back home?
I'll be honest, that did start to come into play. I really enjoyed being at Tulane. I liked being away. But part of me was also like, it would be kind of nice to be a little bit closer to home. And so, um, I got into a few schools, but Illinois was kind of, first of all, kind of one of the better schools that I got into.
Hmm.
So it wasn't like there was a big trade-off to make there. And also, yeah, it was kind of nice to be a little bit closer to home again and
Hmm.
sort of get back to that.
Yeah. Yeah. So you get there, and what was that first year like for you? Because it's funny, you said he thought it would just be like the smooth continuity with like undergrad only a little harder. So what was it? What was that first year like?
Well, I mean, it definitely was quite a bit harsher than undergrad, that's for sure. I had taken, several advanced math classes and had done pretty well. So it didn't like totally run me over the way, some naive PhD student entrants experienced. But I really loved it. I loved that it was harder. I loved that it was really challenging, and I felt like I had to, work more to get the problem sets done. And I enjoyed the challenge a lot. And
Mm,
a lot of people have, of course, it's been a while now, so maybe I'm looking back with rosy glasses, but a lot of people have really negative experiences in the PhD, which I understand and I totally appreciate. But I think my experience was pretty positive. I found it pretty exciting, and I didn't feel like the challenge was overwhelming. It
mm.
was challenging for sure, but it was kind of fun.
Had you been challenged like that before? Was this because I remember you were saying high school was kind of boring, which is kind of like sometimes that's a statement of I'm not being challenged or something, or like it's just kind of it comes up a lot in the podcast where people find the high school experience to be sort of lame a little bit. Do you think that this was like the first time you were experienced something this hard?
I mean, I think it was definitely the first time I experienced something academically that hard. I mean, I found some of the advanced undergrad math classes to be pretty hard too. I mean, I found analysis to be very hard. But I think aside from that, it was definitely like the most challenging material.
Mm,
But I was really motivated for it. You know, it's hard, especially when I was a teenager, it was hard to be motivated for something that felt very, not even that it wasn't hard, but just like, I don't care about, memorizing these dates or, reading this thing that my teacher picked out for me. But I
mm.
think, you know, I was really interested in economics. So, I mean, it was harder, but it was a lot easier to like put the time into kind of,
Because you cared about the goal.
yeah, yeah, exactly. Yeah.
Right, 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 right. So you've got this. So you finished that first year. What are the field courses that are being offered, and what do you end up taking?
So I took labor and econometrics for the field courses.
Hmm.
Um, and they were both they were both great. But I really, really liked labor. I really liked just the applied micro type of papers that we were reading. And of course, we read like very classic ones like Mariel Boatlift and I think Levitt's like RCT with the charter schools in econometrica and a lot of the like really classic papers. I mean, I think this is one thing you read all the like really great papers in the field classes. It kind of gets you like pumped up a little bit to be
Yeah,
working on it.
right, right. Who's teaching you labor?
So Darren Labatsky taught labor, and he ended up being my advisor. So it was, yeah, obviously it was a great class.
Hmm. So you end up writing your dissertation is essays in applied micro. What are the essays that you ended up writing about? Or do any of these get published?
Yeah, so my job market paper this was really when I started getting interested in health because this was, you know, right when you're writing the job market paper. This is right when all the debates about the Affordable Care Act are going
Hmm.
on, and there's lots of, just high level discussion about like what should our healthcare system look like. So,
Hmm.
um, I had two papers that were on um, the
You
previous
graduate in
healthcare.
2012. You're graduating in 2012.
Yeah,
So it's like the first you were there during the beginning of the Obama administration.
yeah, yeah,
Okay. And so
yeah.
there's this, you're here watching all this debate about
Hmm.
healthcare reform. And okay, so now I get the context. All right, so you're hearing that
Yeah,
and you're gonna write not on labor.
yeah.
Or
I
are you?
mean,
Am I breathing it? Or are you? I was looking at, I know you have these pubs that are immediately about the Romney care, but I am kind of remembering something that did sound a little bit labory. Go ahead and tell me what you're studying in these essays.
yeah. So I don't know that you would call it labor. I guess it would be more public finance. But I did have two papers on the Massachusetts healthcare reform. So this
Yeah.
was, you get to grad school right around the time you're starting to think about what should I write for my dissertation. This was right when like Obama's elected, all this debate about the Affordable Care Act, and then it's like right when you're writing the papers that, it's the ACA is passing and there's, so it was just like at the really, really top of mind, I think, which is one
Hmm.
reason, I mean, my cohort and just the cohorts, plus or minus 1 year from me produced a huge number of health economists. And I think that's probably part of it. There was just this
Oh,
general zeitgeist at the time of just like, this is such an important topic. We just really don't know. Is this going to work?
right.
And so that, I mean, I think you can look at a lot of people who graduated around that time. A lot of them were working on topics in healthcare.
Graduating during like the first Obama administration.
Yeah, yeah. Let's say like
Right.
2011 to 2013 or 14. Like I think,
I never even thought about that. Okay. Yeah.
yeah.
So tell me what these essays were.
Yeah, so well, like a lot of people's dissertations, they weren't all totally
They,
coherent, but I kind of
yeah.
had two strains. So I had started off writing about almost like a consumer finance type of paper. So I have one paper on that. But the two healthcare papers, which is kind of the direction my career went, were both on the Massachusetts healthcare reform, which happened in 2006. So it was sort of a nice thing to study because it was very similar to the Affordable Care Act, but we knew we weren't going to get the Affordable Care Act data for like a while. And so I was interested in the Affordable Care Act, but looking at
Mm,
this previous state level reform was kind of a chance to look into it. So I had two essays on that. One was about the financial effects of the Massachusetts healthcare reform, and I was looking at bankruptcies. This
mm,
eventually became like subsumed with a co-authored paper I ended up writing with Bash Mazumdar, who's at the Chicago Fed, using like additional data. So I was originally just looking at bankruptcies, but we were able to
mm.
pull in lots of credit report data using the Fed
What's the
resources.
mechanism? What's the mechanism for Romney Care and bankruptcies?
Yeah, so there's just a general, so Romney Care basically, you can think of it as the Affordable Care Act, like it expanded subsidized health insurance coverage.
Mm-hmm.
And the mechanism is that people still use, like the uninsured still use a lot of medical care, even if they're not insured, because they might have a medical emergency or they might just really need some care and they're paying for it out of pocket. And a
Oh,
lot of
personal
these,
bankruptcies, personal
yeah,
bankrupt.
personal
Yeah,
bankruptcies.
yeah,
Yeah.
yeah, yeah, yeah. Okay. I thought you meant firms. Okay, got it. Right.
Yeah, yeah, yeah. Yeah.
Yeah. Oh, so what do you find?
So we found well, we found kind of an improvement in financial outcomes in general. We didn't find I think we found a reduction in bankruptcies, but I don't think it was statistically significant in that paper. But we did find an improvement in like, bills being sent to third-party collectors and other
Mm,
measures of financial health that you can see on the credit
mm-hmm.
report.
Mm-hmm. When does the Oregon Medicaid experiment come out? Are you writing around the same time as that stuff?
Yeah, that fortunately came out afterwards because I feel like it might have my dissertation work might have struggled more if you have, genuine RCT evidence looking at kind of the
Right.
same question, which is like the
Same
effect of
question. Yeah. Right.
insurance. So the Oregon stuff was just a little bit after I completed
Mm.
my dissertation.
And that paper, the bankruptcy, is that the one that ends up in AEJ policy
Yeah, we have that one is an AJ policy.
in like 2016? That's like a few years after you graduate.
Yep. Yeah.
Yeah. Okay. Okay. So what was your job market paper?
Yeah, so then my job market paper was the similar sort of empirical setup where I'm looking at areas in Massachusetts who had different baseline levels of being uninsured. So you have,
Hmm.
a program that expands insurance to the uninsured. Places that have, 30% of the population uninsured are going to have a bigger effect than if you have 2% of the population uninsured. And so it uses that within state and then also across state variation with like a triple diff kind of set up to
Mm,
look at emergency department usage and
mm.
finds this reduction in emergency department care.
Oh, wow. Wow. I mean, Sarah, uh, so there's like a group of PhD students who, you know, they go to graduate school, they're like really good in they're excellent graduate students. They do very well in their problem sets, they do very well in their exams. and but then they like can struggle to find like a topic and struggle to write papers. But I get the sense, you might also have done really well and everything, but it seems like you also are just like hitting the ground running, because like I was looking at your Vita and it's just like so, you've got papers that are being published, two papers that are published solo in 2012, which is when you graduate. So you must have like in graduate school started putting pen to paper pretty much really quickly. Is that true? You were doing research like really, really fast?
I mean, I think I really did jump right into it. This sort of consumer finance project I have, which was published in the Journal of Financial Intermediation, which is like a finance field journal. I think I started working on that maybe my second year, maybe
Hmm.
halfway through my second year. So I would definitely say what I liked about grad school was writing the papers. I still really, really like writing papers. I mean, it's just,
Hmm.
I get a lot of consumption value from it. I really enjoy it.
Hmm.
It's not just like, oh, I've got to do this so I can get tenure or something. Like I do really like that part. And that was definitely true in grad school. And I wrote a lot of papers. I wrote a lot of papers in grad school that never saw the light of day, though, they are in the memory hole. I remember them. But
Hmm.
I definitely would say I was, that was the part that I did better on. What definitely I wasn't the top of the class in terms of the problem sets and the exams and things like that. I mean, I did okay, but um, I did really have a lot of fun writing the papers, and I thought it was
What
like,
does it make you feel when you're writing these papers? When you're like, when you say it's consumption value, what is it? How are you? What is it about it that, what do you feel when you're doing these things?
it's just like the excitement of discovery and being creative, and I mean, there's something that feels really exciting about, you have an idea and you like get the data set for the first time and you hit that reg YX. And there's something
Hmm.
about that and then something, you get to know something before anyone else. It's kind of like a fun experience, I think.
Yeah.
I mean,
Yeah.
of course, there's parts of it that are, dealing with referees and dealing with, more boring data tasks, not necessarily super fun, but I'd say overall, especially because I feel like back then and, a long time ago now,
Hmm.
I almost feel like papers were simpler, right? I mean, like, I thought my job market paper was great and I think it was really good at the time. But if I were to write that paper today, I know it would have a much longer appendix. It would have, where we've learned a lot about econometrics. I mean, we've learned a lot about different things that can go wrong. And so I think there is a lot more of that getting into the nitty gritty,
Hmm.
which is maybe a little bit less fun. I mean, I still enjoy it, but like, it just each paper seems to take a lot longer now
Yeah.
than it used to.
Right. 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 But you just, if like the faculty was watching you, like, it's like in the faculty lounge and talking about Sarah Miller, they might say, boy, she really loves writing papers. Was it noticeable, you think?
I mean, I don't want to put words in the faculty's mouth, but I do think I did have. I mean, I had a four chapter dissertation, which I think is a
Mm,
lot. And then when I was on the market, I had three R&Rs at that point.
mm.
So I think that's good. That's a good amount of productivity for a PhD student. Plus, I
Totally.
even really liked writing papers in undergrad. I wrote a lot of papers I really enjoyed just in my like upper level
Um,
undergrad classes that I thought was, just a blast to do.
yeah. Did the craft of it come natural? The craft, like the genre of the economics article, did it all feel like it felt real natural and made sense to you?
I mean, I think there were parts of it that did. My work is very applied. I'd say every time I tried to put a model in the paper, it ended up coming out of the
Yeah.
paper and going into the trash can. So that
You're like,
that part
why'd y'all
never
make us
was,
learn this?
yeah, that I was never very successful at that
Yeah.
piece. But the data and the making the figures and things like that, I really enjoyed that part.
Yeah. 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 So you graduate. You go on the market. You end up taking this prestigious postdoc. I don't even, do they even do the Robert Wood Johnson scholars
They
anymore?
don't. Yeah,
Yeah, they
they
quit
don't.
doing
They
it.
don't do the one that I did, which was for
Yeah,
social scientists, which is kind
right.
of a shame.
It
But
was wonderful. So you were in, I mean, you chose Michigan. Were you thinking about any of the other schools?
well, at that point, I had a partner who was at Notre Dame, Andreas Hagemann,
Oh,
who's
got it. Okay, that's the Notre Dame part. Keep going. Yeah.
yeah, yeah. So I had an interest in being close to Notre Dame, but I really loved Michigan too. I mean, Michigan was my top choice. It's a great, I mean, it was then and still is now a great school for
Wait,
labor
okay. I thought
and
you did
veterans.
Robert Wood Johnson at Michigan. You
Yeah.
did it at Notre Dame?
No, we did it. I did it at Michigan.
Oh, it's close.
Yeah,
You're,
but it was closer. The other
I,
options were Berkeley or
yeah,
Harvard, so it's a
I
lot
see.
closer to Notre Dame.
I got it. I can't ever remember this Midwest stuff. So
Mhm.
how far away is Notre Dame from Michigan? Like a
Oh, it's a
drive?
2.5, 3 hours, something like that. So it's
Oh,
not super
okay.
close, but it's
Got
close enough
it.
you can come on the weekend.
Got it. Got it. So you do this thing, you go to Robert Wood Johnson, and who are you working with at Michigan? What's your life like at the postdoc? I mean, you must be so thrilled. Or I don't want to put words in your mouth, but is it really exciting to be there?
I was so thrilled. I mean, it was such a wonderful experience. I mean, so, one thing that was really nice about it was that it was an interdisciplinary postdoc. So there was me as an economist, there was a political scientist, and there was a sociologist. So I had a lot of fun interacting with them and the other cohorts of the postdocs. So it was kind of a nice chance to get feedback on your work from people who maybe see things differently from you.
Mm,
And then just being at Michigan and going, I mean, there's tons of seminars here. Which brought in tons of really cool people. I started
mm,
working with Tom Buckmuller, who's in
yeah.
the business school, and he's my colleague now. And we started working on a paper together that, was a lot of fun to write about Medicaid coverage of dental services, which I thought was I mean, the paper is really about how providers respond to changes in Medicaid eligibility.
Mm.
But we worked on that together. That was a lot of fun, and yeah, it was a wonderful experience, and it was nice to have. It was like a year after grad school of just a little bit of a pause of just working on getting everything done before you can jump into teaching.
Yeah. Wait, did you have something lined up at the same time?
Yeah, so I had an offer from Notre Dame and so I was at Michigan for 1 year. I taught 1 year at Notre Dame.
Uh-huh.
Andreas, my husband was at Notre Dame this whole time. And
Uh-huh.
then we both went to Michigan after that.
Oh, okay. So Michigan wanted to keep you.
Um, well, they wanted to recruit my husband actually.
Oh,
So
okay.
they recruited Andreas to economics and me to the business school. So it was
Oh.
kind of I mean, I like to think that they wanted both of us, but
Yeah, sure.
it
Well,
worked out.
that sounds like the power couple. Uh, wow. So you end up so you're there for just a year. But so the Robert Wood Johnson was only 1 year? I thought it was two.
It is 2 years, but we had a deal where I would teach my Notre Dame teaching. So I would be at RWJ and the truth was I was spending a lot of time at Notre Dame as well because my partner was there.
Yeah.
Um, so I was at Michigan for 1 year, kind of full time, and the second year I did my year of teaching in the second semester, and so I was
I
sort of
see.
halfway between. I had a lot of flexibility since I was only teaching one semester,
Got
but
it. Got
I
it.
was
Got it.
spending a lot of time at Notre Dame at that point as well.
Yeah. Yeah. So how many papers did you end up writing while you were at Robert Wood Johnson? Did you just come, you end that thing with just like a massive amount of work that you got done?
I mean, I don't know that it was completed in that year, but I would say the biggest thing I got out of the Robert Wood Johnson Foundation postdoc is I met a woman named Laura Wherry, and we started writing papers together. She had just written
Mhm.
this like amazing job market paper coming out of Harris on the long-term effects of Medicaid eligibility and childhood on mortality. And I was really
Mm.
interested in, and I guess we were both interested in looking at like prenatal coverage. And this was also a time in the profession where there had been a lot of papers about negative shocks during the in utero period and having long-term effects. But at that point, there was like nothing on what kind of positive shocks might have beneficial long-term effects. And so that seemed like a really natural place to start
Mm.
digging in a little bit more. And so we started writing about that. And we just collaborated together really well. And we ended up, I mean, I think we've written like more than 20 papers together at this
I
point. So
know. How did y'all meet then? At Robert Wood Johnson?
yeah, so she was doing a different Robert Wood Johnson postdoc at Michigan. She was
Oh.
doing a postdoc that was more for, I think, like policy and demography. And I was
Mm.
doing the social science postdoc, although the reality was they were very similar.
Hmm.
And so
And you socialize? All the Robert Wood Johnson people are socializing together?
yeah, my advisor actually emailed me and he said, I met this woman named Laura Wherry, and she has similar interests to you. You guys should get a coffee. And so then
Mm.
I emailed her and we grabbed a coffee and we chatted a little bit. And then
Hmm.
we started talking about this, this idea to look at this, um, these expansions that happened, previously to pregnant women, low-income pregnant women through the Medicaid program, and then see if there were these
Not
long-term
ACA though.
effects.
Not
No.
ACA.
Yeah, this was before the ACA. This was a previous expansions in the Medicaid program. And this ended
Uh-huh.
up being this paper that it took a long time to get published, but it was eventually published in the Journal of Human Resources in
Hmm.
2019.
Hmm. Hmm. This is the first paper y'all write together. You're doing it, Robert Wood Johnson. How can you tell? So do you can you tell pretty quickly? You're like, huh, I've had other co-authors, but this thing with Laura feels kind of different.
Yeah, I mean, if you know Laura, she's just such a great person to work with. I mean, she's so smart and she's just so great at problem solving. I mean, when I started working with her, I was like, oh my gosh, this is like jackpot. I mean, I felt like I mean, she's wonderful to work with. And she's definitely, I hadn't actually co-authored a lot of papers before that, but she was,
Oh yeah,
yeah,
that's right. Because you got a bunch of solo stuff at the beginning.
yeah, all my dissertation work was all solo authored, but I was,
Huh.
it was definitely, a new like experience to have a co-author. And I was like, oh my gosh, this is so much better than just doing this. You're just by yourself on your laptop. It's a
Hmm.
lot more fun if you have a co-author.
Well, so what makes the two of y'all work so well? A lot of co-authoring is a disaster. So, or some is. I mean, I remember my colleague, my co-author Manisha Shaw, she had said, and Joe Price told me this too. He said, once you find that long-term productivity has a lot to do with finding the right people. And it's clear, like you guys are. I mean, in my mind, I always think of y'all as like really good friends too. Is what it looks like two people that really like each other too. So what is it about the partnership that's like, works so well and what is your comparative advantage in the whole partnership?
Yeah, that's a great question. I mean, I think one thing that makes it work so well is like we have just been in like the same stage of life, I think, throughout our
Oh,
co-authorship trajectory. So we meet when we're both getting started in our careers. We're both very like, ambitious. We're looking to write papers. We want to get tenure. We're really in that kind of intense assistant professor period. We both have kids around the same time. So we both have like similar, I mean, it sort of changes what you can do and like what you want to do.
yeah.
And so we kind of go through that at the same time. So it's always really lined up really well. Like,
Mm,
and our I feel like our kind of work style has changed over time, but we've kind of changed together with it. So like when we
mm,
were just starting out, I think we worked a lot more. But since we've had become moms and had kids, I mean, we just work during normal work hours. We don't work on the weekend. I mean, we have the same sort of expectations. Whereas if I was working with someone who's one of these people that works late into the night, works on the weekend, I don't know that it would click as well because expectations might be misaligned.
mm-hmm,
Also, I
mm-hmm.
think we're very understanding of each other. If, oh, I was going to do this today, but kid's homesick from school. we both have been there at different points. So I think
Mm.
it's kind of a nice collaboration in that way.
But so, am I hearing you right that it's not really obvious that, like, she's really good at this thing and you're really good at this thing? It's more like it's not some kind of like, she's the theorist and I'm the one that writes the paper. It's like it's a lot more, the complementarities are, y'all have a lot of the same kind of talent a little bit. Is that right? Am I wrong about that?
I like to think so. I mean, I think Laura is pretty good at everything. So, I mean, there's definitely some things that she does that I feel like I can't do as well. Like I feel like whenever we get asked to do some like really complicated new method and we have to read some econometrica paper, I'm like reading it like I have no clue what's going on. She's definitely got it.
Mm.
But yeah, I mean, I do think also our interests are really similar. I think we like want to
Uh-huh.
write papers on the same topic.
Yeah.
Um, and yeah, I mean, I don't know. I think we get along pretty well.
Well, this paper that y'all wrote with, is it Norman Johnson?
Hmm.
Yeah,
Yep.
this paper that ends up in QJE on Medicaid and mortality is so exciting, and I teach it literally because I do these diff workshops. I swear I've probably taught that paper 25 times or something ridiculous. It's just like all the time. And to me, I teach it in a lot of different ways, but one of the things is I kind of present it to people as though, like, you know, if you're, because I kind of take the position a lot of times, it's like, yeah, like all of us would love to just pick up the guitar and then just like make beautiful music with the guitar. But like, really the way you learn to play the guitar is you kind of like look at how really good people play music and then you try to like play their songs and then you'll learn over time. And I kind of present y'all's paper is kind of like that. I'm like, this to me is how you go about this is what evidence looks like, both the visualization of evidence and the kinds of evidence and the kinds of tests. And so, it's really a phenomenal paper. And I would just love to hear the origin story of where it came from.
Well, first of all, thanks so much, Scott, for that's really kind of you. I mean, I like that paper. I almost wish we could have written it a little bit later because this was sort of right at the cusp of sort of a lot of the methodological changes in diff and
Yeah.
diff. So we don't have the sort of full suite of robustness checks I think we might have done today. But
I
thanks
bet it
for
wouldn't matter
sharing.
though, because you've got such a large never treated group.
Yeah, I
You
don't think
probably
so
like would have
either.
just it really I don't get the sense you've got any of the negative weighting stuff.
Yeah, and mo almost all of our states are treated the same year, so there
Yeah, I
isn't a
know.
lot of staggering, but
Right.
yeah, Laura and I had written at that point a couple papers about the Affordable Care Act. So
Mhm.
it was sort of a setting that we already knew really well. We started writing during our wrote a paper for the New England Journal of Medicine that we started writing when we were postdocs together.
Yeah.
And so it's seemed really natural to look at it. And I think one thing that motivated us is we had this census project where we could sort of follow people's mortality longitudinally over time that we had set up to look at Medicaid in general, and our thoughts were looking at like long run Medicaid coverage, although we also consider short run coverage. And I saw Alex Hollingsworth present his paper that he has published in the Journal of Public Economics on the challenges of measuring mortality in like aggregated mortality data where you don't know anything about the individual person, because what
Yeah.
happens is a lot of the people that's in the aggregated data are just like they're not affected by Medicaid at all because either they
Right.
had insurance or they're too high income, whatever.
Mhm.
And so I remember talking to Laura about that and us sort of thinking like, well, but wait a minute, we actually could see um, some of these things that is like this big limitation of the aggregated data. We actually could actually see this in the American Community Survey. We have this
Yeah.
data in our census project right now. And so we thought, oh, well,
You
maybe this
can
is what
see what? What are you going to see in the ACS?
we can see their household income, we can see their citizenship status, we can see their education level, we can
Hmm.
see whether they're getting another public program that would have already made them Medicaid eligible. And so we can see these kind of individual level economic social characteristics that are not on the death certificates. That was kind of
Can
the
you
data
see that they're on
challenge.
Medicaid? Can you
And
see that they're,
we can see if they're on
you
Medicaid,
just can't see if they're dead though?
but we can see that we can see that they were dead because this is using a linkage between the survey. So the survey doesn't have, obviously if you're dead, you can't take a survey, right? So that doesn't have
Yeah.
anything on mortality. But the Census Bureau has linked their surveys to the Social Security Administration's mortality records. So you can see
Oh.
someone respond
How'd
to a
you know
survey.
that? You
Hmm?
just knew that? Is that just common knowledge? Was that something you started piecing together?
Um, yeah, it's a good question. I don't remember where I first learned about it.
Uh-huh.
Um, but I remember, Michigan is a big census
Yeah.
project school. We have a lot of people using this restricted data. So I probably just learned about it maybe from
Mm-hmm.
Martha Bailey, possibly.
Mm-hmm.
Um, but we had it in our project already. So we could look at the survey to figure out who is maybe likely to be affected by this based on
Yeah.
their income. Like we could throw out the high
Mm-hmm.
income people that we knew would probably never get Medicaid. And then we
Mm-hmm.
could sort of see their characteristics in the survey and then follow their mortality over time if they were
Yeah.
in expansion or non-expansion states. So
Yeah.
that was kind of the insight of that paper that we could kind of get around this criticism that, oh, if you look at just the average mortality rate in a whole state, you're going to be looking at tons of people who are just
Yeah.
very unlikely to be affected, and then maybe a
Mm-hmm.
small sliver of people where there's actually a first stage. Um,
Mm-hmm. How good's the linkage?
it's very good. The Census Bureau has a lot of information about people, and they basically have sort of a central infrastructure where
Yeah.
they have these anonymized IDs called PICs, and they have lots of information that they can link on. And so,
Mm-hmm.
yeah, I mean, for administrative record to pick, typically a 99% match rate, it is
Yeah.
common. I think for the surveys, it's a little bit lower, but still like in the 90s. So it's actually a really good match rate.
It's funny here. This may or not mean anything to you, but like, one of my heroes is Jon Snow, and I've got the Broad Street pump map on the wall in the living room. And you know, it's so similar because he knows if this household is drinking the water. He just had to go door to door, and like sometimes he had to test the water from the faucet, but like it's very similar to what y'all did. He wasn't just being like big intent to treat stuff. It was like this person died, this person was drinking this water. And so y'all did the same thing. And so you were that must have itself been kind of exciting. Just to think like, oh, we're gonna really, really get around this problem that Alex has brought up. Like this is gonna, and I mean, are you thinking in the back of your mind? Are you thinking, the Oregon Medicaid experiment couldn't really pick it up because it was underpowered, and you're like not going to have that problem. So it
Yeah, I
must have
mean,
felt like it's like this is going to be the definitive answer.
I'm not sure we thought it was going to be definitive, but it was definitely exciting. And, I talked about the like joy of doing research and,
Yeah.
it was one of those things where I remember we talked and I was like, I'm just going to go in the RDC and just look, right? And we already have the data. It's not like it takes a long time to run the diff and diff. And we already had all the state treatment coded up because we had already used it for another paper.
Yeah.
And it was one of those things where you see the output and you're like, this is a paper. I mean, it's
Yeah,
just like
sure.
you look at it and you can just see it in the raw data, even just
Yeah.
plotting the mortality
Yeah.
rates across for this affected group, for in the treatment and the non-treated states. And you're like, yeah, that's what a diff and diff should look like. So that was a really fun, kind of fun
Oh,
day.
it's beautiful. It's just so beautiful because first of all, it's really neat that it's just a paper of a billion event studies. It's just like, so many pictures. And I love that. And I love how careful you are at just kind of showing, yeah, ACA rolls out. And not only do people get on ACA, they are not uninsured anymore. It's like I was just kind of as I was reading it, I was like, I wonder if I would have stopped at any of these points. Like I wonder if I would have said, it's interesting. It's kind of like there's a way to do these papers where you're like you're content to do this kind of intent to treat. And I guess because you had the data, you're like, they are eligible, they're on Medicaid, and they are no longer uninsured. And it's like, you do so much on that kind of quote first stage that that alone is really, really neat. Um, I mean, it's even kind of interesting that so many people are eligible relative to how many people get on Medicaid, you know? I mean, even
Yeah,
that, just quantifying that was just like the fact that not everybody gets on it.
yeah, yeah. Well, thanks again, Scott. I mean, I'm glad you like it. I mean, I think that first stage part is, was a big part of both, the contribution, but also thinking about the mortality effects because it really
Yeah.
kind of made me think more about, we think, oh, there's some first stage, and we can estimate some late, but really what you take as your first stage, in our case, could give you very different answers depending on what you assume, right? Because,
Mhm.
you could think about what's the effect for each person that became eligible, like if eligibility were the
Yeah.
first stage. That's kind
Yeah,
of
yeah, yeah.
assuming that there could be effects on people who are eligible but don't sign up, or, I
Right.
mean, sort of taking a broader point, right? And then
Mhm.
alternatively, you could say, okay, for every person who goes from being uninsured to having insurance, what's the
Mhm.
effect? That's kind of a very different thought exercise because then you're thinking, well, what if you would have had exchange coverage, which is high cost sharing, maybe narrow networks, but now you have Medicaid instead. Well, you're not a complier if insurance is the first stage, but you are a
Yeah.
complier if Medicaid enrollment is the first stage, right? So it's just
Yeah.
it can be a bit subtle, and I think it made me appreciate that a little bit more. Like what you pick actually for your first stage, it's can be pretty laden to some
Yeah.
extent.
Yeah. No, it's beautiful. It's really thought-provoking. I mean, how did you though, when did you guys say, we're gonna do the near elderly? Was that really common in this literature to do the near elderly? Because like you've got this elderly falsification. I mean, I'm not in this literature, so I don't know what's common, but like I love that part of it.
Yeah, that actually came from the fact that these other papers that were doing this analysis with aggregate data were using this older age group. And so our first
As a
approach was
control
like
group.
as the group to look at, right? They weren't looking at the
Um,
younger people. And
oh,
so I
okay.
think our first thought was like, let's go in and replicate these like aggregated versions with the version that uses the individual level eligibility measures, kind of using
Hmm.
the same age group that they were using in these other papers.
Yeah.
Um, but of course, there could be effects on younger people too. And I don't know if you know, Angela Weiss was on the market this year from Harris, and in her job market paper, they actually revisit this question using a much bigger data set than so we're using the American Community Survey. So survey,
Yeah.
it's relatively small. They're using the tax data, which we didn't have. So they can see
Oh,
like everybody. And
huh.
so for us, we found significant effects for like the older group that has kind of higher baseline mortality rates, but in sort
Ah,
of suggestive but not significant effects for the younger group. But they have
yeah.
so much statistical
Larger
power,
data.
they can find effects for all the groups, which is really
Oh,
cool.
really? So it's across the board.
Yeah, that's what they find.
Oh, wow. Wow. Are the magnitudes similar? Because I think y'all are like 9% above the mean.
I think the magnitudes are pretty similar.
Huh.
They are using a proportional hazard model.
Oh,
And so if you compare their proportional hazard model estimates to our proportional hazard model estimates, which we had as a robustness check, the magnitudes are
yeah.
very close. If you
Yeah.
compare the proportional hazard model estimates to the level, the rate different estimates, then
Mhm.
they're a little different, but I think it's a functional form difference.
I see. Well, I love your falsification. I love this. Like, let's look at the effect on the 65-year-olds. That's the thing I really, a lot of the ways I try to tell people, I was like, we don't have direct tests of parallel trends. So we look at before and we look at after. And everybody knows to do these event studies and look before, but it's harder to exactly explain the art of the falsification as being like an indirect test of that parallel trends. And you don't always really have nearly the nice setup of that y'all had with the Medicare people, but it was really beautiful. Did that really something that immediately you guys were like, oh, this is going to just all come together so perfect?
Yeah, I mean, I think we were really I mean, it doesn't always work like that, right, Scott? Like
Yeah.
sometimes you do a falsification test and you're like, oh, maybe we should think again about this parallel
Right.
trends assumption or
Right.
whatever.
Exactly.
But every once in a while, it all kind of
I mean, it
lines
was
up.
just like, it is just such, I mean, there's a lot of the papers that you write and you're like, look, I got to do the job, but like, do I believe it? Right? You're like, well, I mean, given the standards of science and how my brain is supposed to connect to evidence, yes, I believe it. But then there's like ranges of belief that go into it. And I read your paper and I'm like, well, this is about as high up as I could get it. I mean, like this seems it's really hard to figure out what else this could possibly be. It's just such a compelling piece of evidence. I mean, has there been a really positive response to it? I mean, outside even of academics?
Well, thanks again so much, Scott. I'm really glad you like it. I mean, I think overall the response has been very positive. Um, and one thing is, I don't know if you know this Golden, Lurie, and McCubbin paper that came out sort of a little bit after or at the same time as our paper, where it was an RCT where they were looking at mortality. But I think
Hmm.
those two papers taken together, I mean, if you do a diff and diff, you're making the parallel trends assumption, and you
Yeah,
can always worry, right? Like it's not
right.
directly testable. Maybe these states
Exactly.
did something else. Maybe it's not the ACA, right? But to
Yeah,
have that, our paper, which I believe the results, of course, and then also an RCT finding similar results, I think it really changed a lot of people's minds because I do think, economics had sort of after the Oregon health insurance experiment didn't find much in terms of
right.
mortality.
Hmm.
I think there was sort of like this belief that well, most of the care people get when they get insurance is not very effective, it's not very
Hmm.
important,
Hmm.
and so it doesn't really affect people's health at all to not have a health insurance coverage. And I think that belief has kind of, turned around to some extent.
Yeah. Well, I don't want to keep you much longer because I've been talking to you off for over an hour. But you know, uh, now that you sort of are, you're still just so productive. I just can't even wrap my head around, that level of productivity. I mean, it's like I'm so happy you're in the profession, and it looks like you're happy to be in an economist. So I just was wondering, now what gets you out of bed every morning to do this kind of work? What does it take? What is it that you love about your job, and what is it that you're like makes you excited about doing this kind of stuff?
Well, I do still really enjoy writing papers, and I
Yeah.
do, it's just really fun for me. I've just got a new census project approved, so right after this uh, discussion, I'm going to go over to the Census Bureau Federal Research Data Center and peek around at that data a little bit.
Uh-huh.
So I still am really into it, but I would say now that I have tenure and your portfolio changes. I think I spend a lot more time mentoring grad students than I ever did when I was first starting out, and that
Hmm.
takes time, but I think I really enjoy it. I find it very rewarding.
Hmm.
We have PhD commencement today, so it's always I feel like it's the big payoff for
Yeah.
working with students, and then you get to see them, at commencement, getting their degrees, going on, doing amazing things. So I definitely spend more time doing that. I'd say I definitely do more service to try to make my department better or the school better. Also, I have a co-editor position now at Journal of Public Economics, which of course takes up some time. So
Yeah.
it's not like when you first start out and it's just go 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 on the papers. But I like it. It's nice to have a bit of a portfolio of things to do when you show up in the office to work. So
You're sort of discovering you have all these talents, like not just writing papers, but you're like you have talents in being an editor and of mentoring, and it's like the whole. It sounds like you're saying, the whole package of being an economist is kind of continuing to be kind of cool.
yeah, I've been enjoying it. It's been fun.
That's awesome. Well, I really think it's so awesome that you're in the same job as me. And I know a lot of people who just are really inspired by, the kind you and the kind of work that you do and that way you carry yourself. So I really appreciate you a lot, and I really appreciate you giving me an hour and 10 minutes of your time to tell me your story.
Oh, thanks so much, Scott. I really appreciate you having me on, and Yeah, I'm excited to, you've also been providing a lot of public good, so I appreciate that as well.
Cool. All right. Well, I'll see you around, maybe at a conference. Good to see
Yeah,
you.
see you soon, Scott.